The cost of living in South Africa is increasing each and every year. And as a result, many families are under significant financial strain. And they may be looking to cut their monthly expenses, such as their medical aid membership. This also applies to people who would like to join a medical aid, but they simply cannot afford to. While South Africa does have state-run medical facilities, these institutions are usually overcrowded and understaffed. So members are not guaranteed to get access to the healthcare that they need. It is for this reason that you're seeing an increase in the number of people looking for cost-effective private healthcare solutions as an alternative to their medical aids. I am joined by the head of healthcare, Charlene Rix, to unpack this. Welcome, Charlene. Charlene, what are primary healthcare products and what type of benefits do they offer?
Sizwe, I think the easiest way to answer that question is to explain to you why these products were first introduced. What was the problem that they were supposed to solve for? And really, then the answer is simple. So they introduced these products to allow for members that couldn't afford to belong to medical aid to be able to access good quality healthcare. And what I mean by good quality healthcare, really, it's around being able to access doctors, your GPs, obtain medication for things like chronic conditions, and also be diagnosed with that chronic condition before it becomes a huge issue and requires hospitalization. But having said that, they do offer members the choice of choosing a hospital cover. Now, this hospital cover is not the same as medical aid. It only provides for accidental and emergency, okay? And it does come at an extra cost. It also offers things like funeral cover. That is not the main reason it's there, but it does offer value to members in certain circumstances.
Okay. Charlene, you mentioned accident and emergencies. In my world, are these not the same?
Good question. I think it's something that a lot of people get confused about. Unfortunately, with these products, the one thing you do need to realize is there's rules around what gets covered. And one of those things is the fact that on the hospital benefit, an accident would be something like a motor vehicle accident. It's something obviously you can't plan, and there's normally trauma involved, so some external force. With regards to emergency, it's where you need treatment that if you don't get it right now, that you might die, or you might lose a limb or the loss of the working of that limb. So let me give you an example. My child falls off a jungle gym. In my world, that would be an emergency, right?
Yes, true.
However, if you've got this product, what you would need to do is just define, okay, he only needs a little bit of a bump. That really doesn't need emergency care. However, if he did fall off and he broke his arm, then he could go to that hospital and get that arm put into a cast and fixed for him.
Okay, understood. Listening to all these benefits and how the product works, what is the comparison in terms of pricing in comparison to a medical aid?
Okay, because these products are very network based, so because it's got the GP benefit, you have to use a specific GP on the network. And for this reason, they are able to bring these products in at a much more affordable price than medical schemes. So if you, as a medical scheme member or somebody that doesn't have cover, go to a GP, you'd probably be paying about 600 for a consultation.
1,000, true.
Now, these products come in at a monthly cost of lower than that. And you've also got access to optometry and dentistry and the medication as part of that cost. So extremely good value for money for members.
Wow. Just listening to those figures, Charlene, I think I'm ready to take myself and my family and move us to the nearest primary healthcare cover. Tell me, if we were to do that, would we have immediate cover?
Unfortunately not. So when you would join, they could impose a period where you can't claim. So you'll be paying your premiums, and only once you've worked through that period, say 3 months, then you can access that cover and you can start going to the GP or go to the optometrist, etc.
I must be honest, a little bit confusing. Tell me, Charlene, how would I know what's the best decision for me to make?
Sizwe, very, very good question, because healthcare or the healthcare environment is extremely complex. So my recommendation to you would be contact us at SASFIN. the consultants will be able to assist you first to make sure that is this the right decision for you and the product, allowing you to understand what benefits you are purchasing so that you know that they'll actually give you the value or cover those expenses that you're looking for. And as I mentioned, because this product is very much network based, you need to make sure that you can actually access that network.
Yeah.
Can you get to the GP? Otherwise, you're not going to get the value. So in a simple answer, please contact us and we'll help you make sure that you choose the right benefit or product to suit your needs and be able to extract that value.
Thank you, Charlene.